I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes. This morning I'm going to get a little bit more specific on you. Unfortunately, if you've had an injury, you'll know that you can tear your ACL, and then also you can tear your meniscus or the cushion cartilage of your knee. Now there seems to be a lot of discussion, do I need to have that done in just 2 surgeries or 1 surgery? And I don't mean just 2 surgeries, trust me. So there's a big school of thought that maybe you need to fix the meniscus first, get your motion back, come back, do the ACL. And we'll talk about how that came to be. Or, like everybody, all of us would rather do, let's do it all at once. What are the risks, what are the pros, what are the cons? So back 25 years ago, this came to be. All of us were doing this in 2 different stages, and that's because the biggest risk of this surgery was having permanent stiffness in the knee. Remember the ACL reconstructions where there were 2 big incisions, harvesting the graft, hurt like heck. We had to push people so hard to get their motion back. Highest complication risk was scar tissue by a long shot. So for the ACL, what we want is what you hear about, the aggressive rehabilitation. We want to get that motion back as quick as we can so we don't form the scar tissue. That's the way we eliminate that risk of scar tissue needing more surgery. The meniscus, on the other hand, while we want to get that motion back to prevent scar tissue, we also have to go slow in the therapy so that the meniscus heals. In fact, the slower we go, the higher chance that meniscus has to heal. Unfortunately, with the ACL, we don't really need to slow down the motion to get it to heal. It does a good job with motion. So that's where that controversy lies. The stiffer your knee is going into surgery, the worse the meniscus tear is, your surgeon may recommend 2 surgeries and do the meniscus first, come back. If it's a fairly straightforward meniscus that he feels that he can be just as aggressive with the therapy after fixing the meniscus, or it's not slowing you down so much that it puts you at a high risk of scar tissue, 1 surgery is where most of us would lean. I think with modern surgical techniques, minimally invasive ACL reconstructions, all inside meniscal repairs, which I know that doesn't need to make any sense to you, but the risk of surgery doing it both at once is very, very minimal in the vast majority of cases. There are cases where we have to do it in 2 stages, but the majority of the time we can do it in 1. So I know that doesn't answer your specific issue, but if you've had injuries to both the ACL and the meniscus, spend some time talking to your doc about is 2 surgeries right for me or is it just 1? I'm Dr. Bill Sterett. This is your Sports Medicine Minute. Please don't hesitate to reach out to us and we can look at your situation. Thanks.